Hello, my name is Elizabeth Gilbert, and this is my X-treme Makeover PowerPoint presentation for the NU 713 class of Organizational and Systems Leadership for the Advanced Practice Nurse. This is a table of content that outlines my presentation. The purpose of this presentation is to identify a time when miscommunication occurred in my work environment and to discuss variables that influence the occurrence. I'll also describe how conversation impacts an organization's culture and how the organization's conversation approach can foster a new pattern of communication using patterns of relating, patterns of meaning, ways of talking, purposeful listening, mindfulness, and innovation. The goal I have for my organization is to transform it from a mechanistic traditional planning perspective to a conversational perspective, placing emphasis on innovation. By the end of this presentation, the audience will achieve the learning objectives listed on this slide. At the outpatient center where I work, there are 5 procedure rooms and several physicians. Occasionally, a physician has to follow another physician's cases. This will result in procedure delays should any of the cases become complicated or long. The procedure nurses and technicians are rushed to the facility and physician when procedures are running later than scheduled. The following event transpired on a day of these busy, delayed days. My partner, a trained endoscopy technician, and I were in one of the rooms running behind. The afternoon physician was a bit anxious because of the delay, which would cause him to be delayed getting his afternoon clinic. He expected every room faster room turnover to compensate for the time. The patient was brought into the procedure room by the charge nurse to expedite the case. This was not the usual occurrence and resulted in me not having an opportunity to fully assess the patient's reasons for the procedure. As the endoscopy technician was setting up the room, the physician also entered the room to speak to the patient. The physician usually waits in the room is completely set up. The nurse then calls them before they enter the room. However, he was not being very patient on this day. After the physician examined the patient, he informed them that the room would be doing several biopsies for intestinal metaplasia in the proximal and distal parts of the stomach body and proximal and distal parts of the fundus. When this information was stated, the endoscopy technician was still getting the room prepared for the procedure. I labeled the pathology jars as directed and placed them in order they'd be collected. I then returned to the other side of the room where I could chart because I hadn't had an opportunity to do that before the procedure began. The procedure started and the physician began to take biopsies. He did not state the full jar description because he was in a hurry and assumed that we were all aware of what he wanted. The endoscopy technician began to place the tissue in the jars. I was under the impression that the technician had a complete understanding where each tissue biopsy needed to be placed. I was unaware that the technician did not understand the physician's plan. The procedure was 5 minutes in length. Once it was finished, the physician left the room. The patient was taken to the recovery room, and I came back to the room to seal the formalin jars and place them with the requisition slip to go to pathology. As I was sealing the jars, I noticed there were only 2 jars with tissue. The other 2 jars were empty. I asked the endoscopy technician about the jars, and she explained that she'd put the tissue in the first jar for the stomach body and the second jar for the stomach fundus. I immediately knew that this was a mistake. I called the physician and asked him to return to the room so I could explain what happened. I let him know the samples had been combined, so he got very upset and began yelling at the endoscopy technician for being careless and at me for not verifying the technician had a complete understanding of the specimen collection process. The physician stormed out of the room and the patient had to return on a different day for the procedure to be repeated. The miscommunication occurred for many reasons. The charge nurse brought the patient to the room without the nurse having been able to ask important pre-procedure questions. The physician was rushed and did not verify with the entire team the understanding of the procedural plan. The nurse didn't perform a hard procedure stop to confirm the procedural plan and ensure complete understanding from all parties. The nurse did not stay to assist the technician due to the need to chart. The physician did not verbalize the place that the specimens needed to be. The endoscopy technician did not ask the physician to verify where the tissue was to be placed. The nurse did not complete labeling of the specimens until after the patient was in recovery. Some of the lunchtime statements I've witnessed from my fellow staff members speaking about being overwhelmed by patient load. Some days one procedure could have 14 to 16 patients, resulting in an 8 to 10 hour day. During these days, especially, there may be no time for a break, and lunch relief may not be found until late. Some of the physicians are slower performing procedures than others, so a long day with a slow physician causes great stress and frustration. Stressful days with busy patient schedules usually result in a few staff members calling in sick. This results in staffing shortage. When these concerns and others are addressed with the leadership, there is a we have to do what we have to do mentality, but no communication of potential resolutions to the problem. The staff's concerns are not being taken seriously. There are also staffing policies and employee policies regarding calling in tardiness that are stressed by the administrators, but there's never any consequence for the people who are always calling in tardy. This results in a lack of respect for the administration and apathy toward the facility. All of these conversations will result in the staff feeling hopeless, overworked, unimportant, frustrated, apathetic, and disconnected from the leadership. Organizations are formed by two patterns: patterns of meaning, patterns of relating. Patterns of meaning refer to the individual themes of an organization, such as its values and mission statement. Patterns of relating form an organization's culture and focus on the way people engage one another. My organization has created an organization of apathy. The staff no longer care to strive for excellence because it's not appreciated or acknowledged by the administration. If our mission statement is the highest quality of patient care, the nurses wonder why they are still operating with staff shortages and unrealistic expectations for staff performance and patient care. This results in feelings of hopelessness and despair, leaving the staff to ponder why they're exerting their efforts for an organization that provides them with no support. The problems with the organization are a lack of communication, administrative awareness, support, and involvement. Staffing shortages are not acknowledged as a hardship on the staff by the administrators. The administration, because of the lack of appreciation of the strain on the staff, continue to have the same expectations of performance as would be achieved by a fully staffed organization. Organizations as conversation requires relational leading, which focuses on creating positive relationships within an organization. This style of leading will result in an inclusion and empowerment of the staff, which will connect the staff and provide opportunities for the improvement of staff and administrative relations. In relating to one another, an individual discovers ways of being together and establishing meaning in that relationship. Responsive relating, or human interaction, is a process where people can combine their actions to accomplish a mutual goal. Patterns of relating, such as referring to a physician as doctor, show a culturally ingrained understanding of power dynamics. Power dynamics, or power relationships, are present in all organizations. Power in a healthy relationship is not taken, but trustfully given by one person to another based on a need for that power. Relational leading cohesively combines the individual person with the group. Significant relationships build confidence and satisfaction. This confidence leads to feelings of fulfillment achieved by hard work and goals. Accomplishment. Conversations in my organization imply mistrust of the administration due to a lack of relating. Nurses feel like they are being used up and then discarded when they are no longer useful to the organization. The full-time nurses are working 40 hours a week with suboptimum staffing, but being pushed to cut back on their billable hours without decreasing productivity. When nurses do not choose to leave early, they may be singled out by being canceled for an entire shift. This causes the nurses to have to use their vacation time to supplement their income. Talking and listening to one another can create stabilization in an organization. The complex relational view gives an opportunity to change the work environment by participating in quality relationships. These relationships allow transformation and impact the future of an organization through talking and listening. Patterns of meaning are specific themes that exist in any organization. The themes of an organization include its mission statement, vision, and values. My organization's mission statement is to provide the highest quality of care to our patients in a warm, inviting environment. Its vision is to meet the needs of our patients preparing to have procedures. Its values are compassion, accountability, excellence, safety, respect, and service. That being said, nurses have expressed disappointment with the inability to embrace a culture of change. For example, during a previous staff meeting, it was suggested by a nurse that an Employee of the Month initiative be developed. This would be an opportunity to improve staff morale by demonstrating appreciation for the staff members. A small token of appreciation would be awarded, along with a published statement of what made that individual a unique member of the organization. The idea was quickly dismissed because of the monetary and time involvements that the administrators were not willing to provide. Other staff members laughed at the suggestion, stating only a few brown-nosers who suck up to administration would be recognized. Although the organization's pattern of meaning suggests the intent of providing the highest quality care in an inviting environment, conversations with the organization reveal different motivations. Meaning is developed through encounters generally social in nature. Workplace meaning is generally developed through conversation that occurs in the here and the now. This meaning is then processed and used to affect future actions. The gesture-response meaning relationship is built upon communication. A gesture activates a response, and a response creates meaning. In this case, the nurse made a gesture towards innovation and was met with a negative feedback. The meaning received from this interaction was her ideas were not respected or heard. This meant that the organization is not truly interested in upholding its core values. Conversation has the ability to reinforce the organization's values and inspire change. Speaking has the potential to reinforce and stabilize an organization's culture. Using language intentionally create a more authentic, meaningful relationships. Poor use of language and talking has negatively impacted my organization's culture, as evidenced by the conversations about feeling undervalued and unappreciated. The staff feels as though they give their best, but are only met with a do more and do better attitude. Language is not being used to exemplify the organization's values, create authentic relationships, or create meaning. As we discussed earlier, response creates meaning. To respond to gestures and create meaning, there must be an understanding of conversation. Going back to the nurse that was dismissed in the staff meeting, not only did she feel as though she was not heard, but she also picked up on the laughter and other nonverbal cues that made her feel as though she wasn't taken seriously and that the organization didn't care about creating an environment of change. Mindfulness requires being awake and aware for the moment to moment. Being aware of your actions and what is happening in the environment around you provides an opportunity to engage in organization as conversation. Nurses in my organization continue to talk about being frustrated with the administration and the lack of follow-up when organization policies are broken. If the leaders in the organization were mindful, they might be more aware of the situation, the causes, and the potential situations that need to be implemented to alleviate the issue. Complex organizations composed of the human element are unpredictable and nonlinear. These style organizations should be treated as such, or complications will arise. Strict mechanistic planning can hamper innovation by focusing too much on desired outcomes versus actual occurrences. Both and thinking leads to innovation by valuing multiple points of view and recognizing the value of these perspectives. The and is the innovation portion, which results from conversations utilizing both and thinking. My organization still run in a mechanistic manner where things are expected to happen in a specific way through a specific order. If an idea doesn't fit within the organization's strategic plan, the idea is usually dismissed. This is the either-or style of thinking. Because of this rigid style of thinking, the organization has created a culture which suppresses innovation. Innovators must be encouraged to thrive or they will wither away in the shadows. To move toward an organization as conversation, I would exemplify the organization's patterns of meaning through conversation actions. Patterns of relating provide an opportunity for innovation, organization stability, and growth. I'd focus on creating we relationships and discourage the I or me relationships. I would encourage better communication, specifically horizontal communication, to foster a new pattern of conversing together. With any transformation, one must be willing to embrace the mess. This is accomplished through disruptive engagement, which is uncomfortable but necessary to create an open and honest communication which results in purposeful meaning. Improving patterns of relating would require integration of relational leading techniques, practical judgment, responsive relating, and the two patterns of relating, which are talking and listening. Relational leaders create a feeling of empowerment and worth, which is based on trust and communal participation. Relational leaders are able to use practice judgment to improve in the moment and act in a way that generates positive meaning. They can determine what actions are appropriate for the situation at hand. Responsive relating is utilization of the cohesive and commonality of an organization's team members to form relationships. The importance of verbal and nonverbal language will be a primary focus. To change the story of my organization, I would stress the mission, vision, and values and strive to uphold those themes. For example, innovators would never be dismissed or ridiculed for suggested changes. Instead, they would be encouraged to research and discuss prospective opportunities openly. This encouragement would provide opportunities for innovation and responding in a manner that reflects usefulness and meaning, which will transform the culture of the organization. Language represents the organization's values and demonstrates authenticity and meaning in organizational relationships. People within the organization should understand how to purposefully listen, which will generate shared meaning. Attending the conversation, paying attention is essential in collaborating communication processes. Mindfulness contributes to organization as a conversation. A person can be mindful by being alert from the moment to moment. To change the story, the one that promotes innovation, my organization would need to stop utilizing mechanistic planning, utilize both and thinking, and encourage rather than discourage innovators. Mechanistic planning is useful in certain situations, but does not promote innovation. Innovation can also be called transformational communication, which is a messy process. Innovation emerges from conversational vulnerability, misunderstandings, and curiosity. The story should have gone like this. I brought the patient in the procedure room. The endoscopy technician was able to finish completely setting up the room before the physician entered the room to speak to the patient. After the physician examined the patient, he informed the room that he'd be doing several biopsies for intestinal metaplasia in the areas discussed. When this information was stated, the endoscopy technician and I were attentively listening. I labeled the pathology jars as directed, placed them in the order that they would be collected. I, having completed my pre-procedural charting, then remained at the bedside to assist the technician with the specimens, and the procedure started. The physician began to take the biopsies. He stated the full jar location description, and the technician began to place tissues in the jar. I was able to close the jar as they were being filled to prevent any confusion. The procedure was 5 minutes in length. Once the procedure was finished, the physician left the room. The patient was taken to the recovery room, and I was able to take the specimens with me at that time because all of the charting had been completed. The samples were labeled correctly and the patient did not have to come back for another endoscopy procedure due to medical error.